I'm Jenny, I currently work at the Newcastle Eye Centre and I'm training as an ACP in Paediatric Ophthalmology. My new role involves a lot of multidisciplinary team working, so I'm working a lot more closely with the optometrists, the paediatric nurses and the paediatric consultants. So this provides joint care for the patients and also helps develop new patient pathways. I'm also doing some competencies in slit lamp and eye care, so I'm able to assess the patients, and also shadowing a lot of different professionals and learning additional skills such as interpretation of OCTs. My working week, as I'm currently still training as an ACP, I still do quite a lot of the standard orthoptics. So that's seeing patients, paediatric and adult patients, and also doing squint listing. So I've done some consent training in squint listing pathways and being able to list patients for paediatric squint surgery. As part of the ACP training, I'm doing a lot more of the teaching side with the consultants and the junior doctors, seeing a range of general paediatric ophthalmology patients, and also more condition-specific clinics such as sticky eyes for patients presenting with nasolateral duct obstructions, and also chalasia, blepharitis, conditions in which I'm able to assess and manage the patients. And then looking further, I'm working with the optometrists to develop more clinics and involvement with uveitis screening and paediatric contact lens patients. As part of the ACP role as well, it involves developing new pathways and service improvements. So I've got admin sessions in which I'm able to work on those and develop more practical skills. I decided to train as an ACP in paediatric ophthalmology because part of my new role in paediatrics, I felt like the ACP role and study was a more structured approach to the knowledge and skills I would need to work in paediatric ophthalmology. I also felt like a lot of the pressures on the paediatric service were around staff shortages and the consultant workload, and so I thought this was a good way in developing the skills and the training that I needed to tackle some of these ongoing pressures. So practical training has mainly been through consultants and junior doctors, working through competencies for condition-specific conditions, and also in examination techniques such as slit lamp and eye care. A lot of the theory that I've been learning has been through the ACP units, working through a lot of the anatomy and my own study time. The support has been really helpful from the team and the consultants. Going into a new learning role can be quite daunting, so having that support has been really useful because it can be quite isolating at times being back into a learning position, so I really appreciate the support and communication with the consultants. So this is just checking the pressure of your eye. Within my trust, I think an ACP role would be really advantageous because it would take off some of the pressures of the consultants, decreasing their workload. We would see patients more confidently and competently. I think it would really improve the paediatric service by developing new pathways. One of the main barriers to progressing more autonomously with the role would be the fact that the inability to do independent prescribing, but hopefully with the impact of some of the Prescribing Now campaigns and moving this forward, that would create more autonomy within this position. I feel like there's already been an impact with some of the pathways that I've created, especially with the squint listing pathway. Patients are currently waiting less time, and we're currently auditing that service to hopefully show patient satisfaction as well. So we've given out some patient satisfaction questionnaires to see if they are happy not seeing a consultant within that service, and also hopefully show reduced waiting times.
Thank you.
I've also created a lot of new information leaflets for paediatric patients and been working closely with optometrists to develop some more pathways in uveitis screening and paediatric contact lenses.